Hello, everybody. Thank you so much for joining us. Nearly 50 years. Yes, so here we go. Dr. Vigoren, welcome, welcome. We're so glad to have you on this show.
I was going to be introducing myself as the head heretic in dentistry.
Oh, you can go right ahead.
And my entire career, I love doing dentistry. I love doing restorative dentistry. I still practice 5 days a week, and I enjoy going to work every day. And my whole basis for some of the successes I have, I think, go all the way back to dental school when all my first patients were my family. My mom, my dad, my uncles, my two brothers, and I didn't realize that getting asked to do the chairman of the department's reconstruction was an honor. I just thought it was my number coming up. And, the same thing to do with the president of the university's daughter. They pulled me to be her dentist in Japan, and I got to rotate through 4 dental specialties. And when I came back, my hobby has been continuing education, lecturing, putting on meetings, finding speakers. And so you acquire a wealth of contacts and information because you're always looking for the next thing. And I just gave this lecture or a lecture like this at Long Beach City College, and I don't know, 35 students, health and wellness course. And I said to him that one of the best things I ever learned in dental school was from the dean. One weekend, he came in and he said, "You're going to be expected to learn a lot in the next 4 years. And I can tell you henceforth, 50% of what you learn 10 years down the road will be either outright wrong or correct for the wrong reason." But he said, "I can't tell you which 50%, so you got to learn it all." Well, being the heretic that I already expressed I am, I said, well, if 50% of the information's wrong. And so I've always kept my ear to breakthroughs and innovation, and it served me very well.
Excellent. So yes, breakthroughs and innovations. And earlier when we were talking about your methodology for learning, could you discuss that?
I told these students that if they really want to live long, and the impetus for this was when I was in Japan, I learned about the last man standing, and it was a group of World War I fighter pilots who all got together after the war and drank and became great friends. And they all chipped in some significant amount of money, and they bought something that normally somebody wouldn't indulge in. That prize went to the last man standing, the last survivor in the group. And so from the age of about 27, health and longevity and nutrition and exercise and being as healthy as I could, literally became a hobby. And when I went into continuing education, and we put on 50,000 person meetings, on 24 of those, and you have a $1.7 million budget for speakers. And so you can bring a speaker, anybody from anywhere in the world. And when you get to choose who the speakers are, you tend to pick people that you think are going to help you in your health and longevity, or your parents in their health and longevity, or your children in their health and longevity, or your patients in their health and longevity. And after 50 years of doing that, you get to meet a lot of really smart people. Okay. But what I told this group or this class is that, and if you learn how to learn, you will have an advantage and a leg up on everybody the rest of your life. You will be able to go through data and learn things and be more accomplished faster than the next person. And so I told them, when I find something that is innovative or really interesting or new to me that I think is going to be valuable, and I don't do this for everything. It's, I probably run across something like this once every couple of 2 or 3 months. And what I'll do is I'll go through and I'll listen to it or read it really fast the first time without worrying about understanding anything. And then the second time, that's 2 fingers. Sometimes I say the second time, I know really not communicating very well. But the second time I'll read it and I'll pull out any acronyms or terms, words that I don't understand, and I'll write them all down. And then I'll look them all up on the internet, and Wikipedia will work for most of that stuff. And I'll write down any additional acronyms and terms I don't understand. And then I'll read it the 4th time and the 5th time for memory. And those things I don't forget. now I can't remember what day it is or tell you what time it is or all these other things because I depend on other people for that. But important information and for me to integrate into all the other things in health and nutrition.
So you go very deep when you read, and words that you do not understand, you look up, and that gives you a deeper context of understanding of the article. I know when I read an article the first time and I just discount those words that I don't understand, and I tuck them in the back of my head also to look similar to you, to look up later, but I don't time and time again.
Well, I'm just more organized because I know if I don't do it that way, I'll forget it.
Well, organized and also committed to learning the concepts and really understanding so that, well, you can teach it. If anybody
Yes.
asks you a question about a concept, you have the deep understanding, you know how to learn, and you use it when you are communicating with other people. So I
Well, I
think,
can glass over most
uh-huh,
people
uh-huh.
with all the information I have. So I have to watch out. I have to chunk it down
Well,
and
you have decades of learning
yeah,
also
yeah,
underneath
yeah.
your belt so that you've retained. And so let's go back when you first started diving into health and longevity. So you were interested in knowing how to live a really long and good, healthy life.
I just started bringing people in on nutrition and exercise and
Yeah.
I had low back problems. Oh, and
Oh,
some disclosures too. And, I explained to a lot of people that when you take your dog to the vet and you talk with the vet about the dog is uninvolved and the vet, right? And so almost everything I talk about, I've gone through personally. And so I was ADD. I stuttered. I couldn't read. I couldn't spell. I had a hard time learning anything that was really simple. But when we got into complex stuff, it was easy for me. So the things that were hard for other people were easy for me, and the things that were easy for people were impossible to me. I never learned a language. I have a hard time with English sometimes. Computers and spell checker, I still couldn't publish, and I still do one finger at a time. Okay, and I just couldn't master any of those things. So I grew up with learning disabilities, sleep problems, severe sleep problems, which I didn't get diagnosed until I was 50 years old.
wow.
Okay. And I went in for 5 sleep tests overnight, with all 78 leads on you 4 times. And they kicked me out. They said, well, you're a little funny, but, we're looking at extremes and you're not extreme. So get out of here, and the was that we can't bill for your treatment. And so don't bother us. And so finally, I got a high resolution pulse oximetry recorder that goes on your finger that you wear in a wrist. It records through a wristwatch and it records at very high resolution. And I found out that I was having 29 waking up arousals. What do you think that did for my sleep? I was crazy. Okay. And that goes back and affects learning and affects behavior and affects how people perceive you, and Greg's so scattered. He's got the curiosity of 10 cats and he's got a control mechanism of an Irish setter.
Wonderful sense of humor.
And, over the years, people have said, well, you're a genius. I go, no, I'm one of the dumbest people you know. You can be really smart in one silo. And as my wife says, you're dumb as a stump in the next silo. And so healthcare generally makes people more and more myopic. What we need more and more global views of things.
Right.
And so, see, I forgot what I was talking about. But
we'll circle back. But you touched on, well, you've observed in yourself that there were some differences. And
right. And I was always looking for the answers. Why am I different?
Okay. And I think that was really a great reason for you to dive deeply into understanding, first of all, yourself and how you are functioning. So the learning disabilities that you pointed out gave you a reason to develop a methodology where you can learn deeply and meaningfully, so that you're reading things through 5 times and understanding and diving deep into those words that you don't quite understand. But now move to the topic of
is sleep. They can improve sleep by improving and eliminating sleep fragmentation. And sleep fragmentation happens because orthopedically during development, because of the changes in society in the last 70 years, we don't nurse for 3 to 5 years, which was what happened for millennia before. And we don't chew hard foods because we have mom's good cooking and juices and things that are easy to eat. And once you give a child broccoli, and then give them ice cream, they will no longer eat broccoli. And so every mother's afraid that their child is going to starve. Okay.
Oh, yes.
And so as soon as the child won't eat something, then you get out the juice or the pureed or the thing that has sugar in it.
Right.
And that child at 2 or 3 years old knows everything that they eat that has sugar in it. And they don't know it because they're biochemists. They know it because when they feel crappy, glucose makes them feel better faster than anything. This food makes them feel better in 5 minutes.
Right.
And they stop eating this. Okay. So because of those changes, the lack of development of the tongue, and the letdown is the free lunch. Okay. But the whole rest of the nursing is extraction by the tongue against the roof of the mouth, and it's behavior that can be influenced by frenums or a high palate or a tongue tie. And mothers always think that they're the problem. They're never the problem. It's generally anatomical with the extraction device of the child, which is the tongue and the palate and the frenum attachments. When you stick your tongue out, that thing that you see on the bottom where you pull your lip down and you see that, if those are shortened, the child can't latch. And if the tongue can't reach a flat palate, it can't extract milk. Okay.
Right.
And so for the next 2 or 3 years, without that scaffolding working, the orthopedics don't reach, the bone development doesn't reach its genetic potential. It's undersized. And so now Western civilization, Western diet, Western culture, on an average, are a half an inch narrower in the molars and, a third of an inch narrower from the eye teeth on both the top and the bottom arch.
And does that affect sleep or how?
Well, it affects the nasal passageway.
Okay.
Because the roof of the mouth is the floor of the nose. And so if you have a triangle that's this big, a 1-bedroom A-frame with 3 bedrooms worth of furniture, you can't breathe through your nose. And you were supposed to have an 3-bedroom A-frame with 3 bedrooms worth of furniture. So when we do cone beam or computer tomography, a very low radiation, very quick scan, you can see the whole nasal passageway. And out of 100 patients that we scan, 98% or 90% of all Western civilization, and it doesn't matter if you came from somewhere where genetically they have great big noses to breathe through when they sleep, Western civilization, Western diet retards that. And that's what causes crowding the teeth. And when you go to orthodontics, if you're trying to straighten the teeth in a bony housing that's too small, you literally move the teeth out of the bony housing and you make 20, 30 years later, all kinds of dental problems. And so now what we're doing through the pulse oximetry data and through the cone beam data that shows us 3-dimensionally what the throat and what the sinuses and what the nasal passages look like, we're actually separating that orthopedically. And now you have a larger arch to move the teeth in, and you have plenty of room, and you've got a big, broad smile, and you can breathe through your nose the rest of your life.
Right.
Okay?
And sleep better and longer without the interruption.
So that's a real quick introduction into sleep fragmentation, which happens when you can't breathe through your nose and you close your lips at night, and all of a sudden you desaturate, and your brainstem gives you a 5-alarm fire bell that says, wake up and swallow. Well, people clench their teeth to move their tongue out of their throat and to flex the muscles in their esophagus, and they breathe, and then they fall back to sleep. And you have to understand, from the back of the throat to the trachea is a collapsible latex hose, and it's got muscles around it. And when you swallow, that's what allows you to swallow, is that thing, a contraction going down there. And so your brain wakes you up, disrupts your sleep, fragments your sleep architecture, and you wake up, and your whole life you didn't realize that you never got a good night's sleep. You think it's
right. Well, that's very intriguing, and you've given us an historic evolutionary explanation of why that's happening with us today. So many
so
Americans.
sleep is the number one
Yes.
correctable health problem. And by the way, it leads to 50 different problems.
Oh,
From
please.
inner ear
Tell us
infections
more.
to asthma, to weight gain, to difficulty in school, ADHD and ADD behavior, is a direct result of this sleep fragmentation. Very, very high percentage of the time.
Gosh, could you tell us some of the research that you've come across?
Oh, I can go into 500 different articles
Well, I'll
on
have to get
that's another one.
some of them.
But
Yeah,
let me move on to
quite a
number
bit.
2. And I'm happy to
Okay.
come back and give
Sure.
any
Yes.
amount of
So sleep is the number one health.
sleep is number 1.
Okay,
Profusion is number 2. What's profusion?
I forgot to ask.
When we study the blood vascular system from the heart, the veins and the arteries and the lungs and everything, we're only looking at 2% of the entire blood vascular system. We have on average, 58,000 miles of capillaries in our body. And it's the capillary bed, the blood column through the capillary beds. And so having a healthy, and I couldn't even say this 2 years ago, glycocalyx, which is a slippery lining inside all the capillaries. It was just a glass tube that stuff perfused through. And now we know glycocalyx that's a word I had to look up many times.
I'm gonna have to try to pronounce it. Glycocalyx.
Glycocalyx. That's the same stuff that fish have on their shells, that when you pick up a fish, they're slippery. It allows them to go through the water. But that's where all the exchange of stuff going into the cell and coming out of the cell goes through. And so if you have a healthy glycocalyx, you live decades longer. And how do you get good profusion? Exercise. And that's why walking gives people so much more longevity, because on a daily basis, you're getting capillary vascular profusion to the extremities. And so neuropathy and people who have diabetes, type 2 diabetes, and lose limbs and feeling, that's all profusion related. Okay, so that's number 2.
Well, can we get back up just a little bit? So is that the same as
Circulation causes profusion.
circulation?
Heart causes circulation. Exercise causes increased circulation. So when you're sitting down, your circulation is at one level. When you're exercising, your circulation goes up. And that causes that 2 or 3% of the blood vasculars put up the capillary beds and give energy and oxygen and nutrients and micronutrients to all the tissue and pick up the trash and take out the CO2.
All right. Yes. Okay. I have a better understanding of what profusion is. And
That's the important thing, is
that
profusion.
is,
At the
yes.
capillary bed,
And we need to have
that's
all of our,
that's where the rubber meets the road.
right, our cells need to be serviced at a cellular level.
When you don't exercise and you're sedentary, you can really cut down on the profusion to the extremities and to the organs.
All right. Excellent. 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 Now we'll delve into number 3.
Okay, number 3 has become very popular, but it's gut health. And you have to understand that the lining of the intestine, which starts at the lips and ends up at that other sphincter. And if you laid that out surface-wise, it's a surface area of a tennis court.
Wow.
Okay. And so 1 cell thick in the surface area of a tennis court. And its job is to have good junction between the cells, epithelial junction, and to keep out bad things and to absorb good things. So it absorbs good things and it keeps out bad things. And it runs on a completely different energy system than every other cell of the body. And guess who makes that energy system? A healthy biome, healthy probiotics, and prebiotics, which are non-digestible carbohydrates, which the probiotics turn into that energy system for the cell wall. So you do understand that cows can't digest grass. Termites can't digest wood. They eat this stuff, and in their stomachs, they have bacteria that convert it into digestible energy for the cow or the termite. Okay. And it's the same thing with us. We eat foods, but if we don't have a healthy probiotic biome that converts the prebiotics, non-digestible carbohydrates, into the energy system, you have a leaky gut, you have all kinds of inflammatory problems, and you don't always transport in the good stuff, and you don't always keep out the bad stuff.
Enzymes help break down the foods that we eat into usable form.
No, that's what cows and termites do.
Okay.
Because they eat wood and they eat grass. Okay. All right. Our healthy biome and healthy probiotics are the organisms that take the prebiotics and turn it into the energy system for that 1 cell thick tennis court surface. So they just feed the gut lining. They don't feed the rest of the body. that healthy gut lining then feeds the rest of the body through the blood vascular system through circulation.
Oh, I see. So there's like
The two-step process. I think it's a holdover from when
yes, that's
worms went through dirt. That gets
Uh,
into science and religion. I don't want to go there. All right.
we have plenty
So,
to discuss.
so
here
number
already.
one is airway. Number two is, and I want to get into technology. Number one is airway and sleeping unfragmented. And that's about nasal capacity in most people. And I learned this with my mother. Remember I told you she's my first patient?
Yes.
She's terrified of the dentist. But when the rubber dam, the dentist didn't understand that she couldn't breathe through her nose. And so what's putting a rubber dam on like? It's like suffocating somebody. And that elicits terrible anxiety, life-threatening anxiety. And that was partially the cause is she couldn't breathe through her nose. And I couldn't breathe through my nose. And most of the patients that we see can't breathe through their nose adequately. When they go to sleep, they lay down and they close their lips and boom, all of a sudden they're collapsing their throat with negative pressure or they're pulling their tongue back because of their position. Their jaws didn't develop to the right. And so they have a SUV in a Prius garage. Okay. And these are all dental growth and development deficits from the genetically programmed bony development. The epigenetics, the things outside the gene, which happen to be lack of nursing and lack of hard foods during growth and development, have undersized our breathing mechanism orthopedically, bony-wise. The bone is in the wrong place. The bone is too small. We have one bedroom A-frame with 3 bedrooms worth of furniture, and it's supposed to be a 3-bedroom A-frame.
Right. So
does that make sense?
Yes, it
Does
does
what?
make sense. I was just going to ask, is this an anomaly of U.S. diet and child rearing, Western civilization?
Anybody in Western civilization.
So other civilizations, other cultures don't.
Well, if you went to, before they got 7-Elevens and had refrigerators, if you went to the South Sea Islands, or you look at the Kenyans or the Ethiopians who win all the marathons, they have a too big of an advantage. The back of somebody's throat on a cone beam is about this big on average. And the Ethiopians and the Kenyans, the back of their throat is this big. They run the entire race with their mouth closed, breathing through their nose, using nitric oxide, which is anti-inflammatory, and they just get better ventilation. I was a runner and my mouth was wide open and I was all mouth breathing. Okay. So yes, other cultures, Africans, Southeast, any primitive culture has a big airway. And any modern culture, that's why I say Western civilization, Western society, Western diet. We switch to foods you don't have to chew. They're processed or overcooked or soft or you can get them through a straw. Okay. It takes no tongue. It takes no chewing. And when you don't get that stimulation from the chewing, you don't get proper bony development. When the tongue doesn't get strong and broad, it doesn't separate the arches. And so you don't take the floor of that 1-bedroom condo and separate it.
Right. So is it reversible?
Yes. Now we do a workup. We look at all the medical indications. We look at 6 or 7 different, actually 10 or 12 different criteria evaluating airway and sleep. And then we actually are separating the palate now, changing people's lives almost overnight.
Right. So in your practice, so the first thing, can you just walk us through your process of how you treat your patients?
Well, it depends on if they come in with a toothache or to get their teeth cleaned. We don't jump on them about airway. Okay. But if they come in understanding airway, then we go to airway first. Otherwise, we go to dentistry first and then kind of give some hints of some of the red flags that we see.
Right.
And, you can see corrugations in people's tongues, excessive wear, loss of teeth. These are all indications of nighttime sleep fragmentations, because what the brainstem does when you wake it up, because there isn't enough oxygen, it's sensing that you're killing me, Smalls. Wake up and breathe. And so it disrupts your sleep fragment, your sleep cycle, which is a 90 minutes, keeps taking you out of that architecture. And your brain stem says, clench your teeth together as hard as you can because you're not breathing, and pull your tongue out of your throat and flex your throat. And so, like I said, when I finally realized this was happening to me, and I went in and I said, I want another sleep test. Yeah, I'm desaturating 29 times an hour. No wonder everybody thinks I'm crazy.
Yes, yeah, I know.
Okay.
You couldn't get any sleep.
Well, I didn't know I was running on adrenaline my whole life.
Yeah.
And cortisol, it's the basis. I'm positive it's the basis of an awful lot of criminal behavior. If you get reinforced for doing good things when you're young, you do more good things. If you get punished for doing the same things, okay, which are sleep related,
Mm.
pretty soon you write off society and you become antisocial and anyway.
Mm.
So
So you treat the patient's ailment that they come in with first.
well, if you don't go to first request, you're going to lose people.
Sure.
I came in here to get a cleaning, I came in here because I have a toothache and you're talking to me about, all this other stuff. No,
No.
you have to treat them first and establish a relationship
Yeah.
and demonstrate. And by the way, that's when I get to the technology, that's what the magnification and the high resolution photography and the high resolution displays do is you can show patients inflammation, redness, bleeding, cracks in their teeth, leakage underneath fillings,
Mm.
and decay. You can show them on a high resolution display at 16 power better than 90% of the dentists ever see it or understand.
You were an early adopter of technology.
Well,
Can you talk about
like I
that?
said, if it's, well, I when I got back from Japan, I had a
Mhm.
friend in Irvine, Jim Hodge. He's now up and retired out of Ketchum, Sun Valley. And I didn't realize it, but part of the reason I was such a good student, 2010 vision. And they could see the person that could see the other plane first won 90% of all dogfights. It's the same thing with Top Gun. If you look at all the Top Gun pilots, they all have 10, they all have 2010 or 1020. And anyway, they all have what's called eagle eye. And so I had eagle eye. I could actually move stuff closer and focus. And I had built in 8.5 power. Okay.
Yeah.
And so I came back from Japan and Dr. Hodge, I was at his office and he said, here, try these glasses on. And I thought, no, the only people that use those glasses were the old instructors in school that were blind. Okay. And so I put those glasses on and I looked in his patient's mouth and I go, oh my God, this is really, I went out and I got 2.5 power loops. And then I went out to 4.5 power is even better.
Wow, it keeps getting better.
And then I started studying working under a microscope, surgical microscope, because I was dissecting things down in San Diego. We were looking at joints and temporomandibular joints on cadavers under a microscope for, a couple of years. And then I got my own microscope, put a video camera on it and a camera on it, and I shot everything through the microscope. And now I've evolved into the fact that, when you learn the letter E in kindergarten, you don't start with the Wall Street Journal and heat type, okay? And they put the E really big on the board, and your visual cortex sees the letter E, and then you can keep shrinking it down as you understand it. And at some point in your life, you can read this fine print in the Wall Street Journal. So that's the way the brain learns. We learn visually, and then we recognize shapes and sizes. That's the way we teach in dentistry. We would take photographs of things and we blow them up on a big screen in front of the whole class, and you could explain stuff and see stuff. Well, that's the way everybody learns. Okay,
Right,
visually.
yeah,
We're visual learners.
Yeah.
We fill in with auditory and other cues. So back to the microscope and using high magnification, every 2.5 power you go up, a student will increase 1 grade point in their clinical skills without doing anything else. Okay. And so 4.5 power, you go from a C to an A. If you're a student to begin with, you're I get 30 and 40 and 50 years longevity out of some of my dental work. Well, it's unheard of. It's absolutely unheard of. The average is 3 to 5 years, and then catastrophic failure and replacement at 5 to 10 years. Okay.
And so part of this is because you can identify the problem early.
You can see it in your motor skills. Your motor skills are determined by your visual feedback. And so a gifted surgeon can work up to 40 power under a microscope before they start to lose control. All right. And that's what vascular and neurosurgeons lots of times use. And that's what Da Vinci is they're using high magnification. You're getting extraordinary results because they have better motor skills and better visual understanding and control. So I did the microscope for years and photographed everything. And got more cameras, had over
Yeah.
50 or 60 cameras.
Right.
And that's what I lectured on, was magnification and high resolution displays. I've lectured, given those lectures all over the world.
Right. So, and you can treat
all over
what
the
you can
US.
see, but also you have instruments that look below the surface. You have instruments that can
Well,
look.
the most important thing in the highest quality of learning and outcomes in dentistry is magnification.
Yeah.
High resolution cameras and high resolution screens. When you take pictures of your work and then you show it at 16 power and you can blow it up to 160 power on the screen, that's like having 50 of your most severe critics standing over your shoulder complaining about what you're not doing, you know, and they won't look at what you're doing right. They'll pick out what you're not doing. And so it makes you a better clinician. And you become much, much better at outcomes and long-term outcomes, and you understand things that they either don't teach at all in dental school, or they teach just the opposite of to this day.
Tell us about that.
Well, for years, you could leave decay and contamination and alteration
Underneath restorations. Okay.
underneath the filling. As long as you didn't go to the pulp, if you took it all out, you're going to have to do a root canal. Just the opposite is true. The deeper you go and the more contamination and altered tooth structure you take out, the less likely you have to do a root canal, and the more stable the foundation is underneath the filling, and the filling can last 4 to 10 times as long.
So why is it that other dentists don't take this approach?
I have no idea.
And what?
That's not what they were taught in school.
Oh, I see. Okay.
And they believe, remember I talked earlier about the baby in the bathwater?
Yes.
They drink the bathwater.
Oh,
Okay.
throwing bad practices out.
Well, it's just the norm. It's the norm out there.
Is it because it's easier?
Well, it's quicker, and change is hard for people. Once you get a degree and you're monetizing that degree in your practice of whatever it is, and you're doing okay, it's much easier to just keep doing the same thing over and over again. And when somebody comes up and says, you know, you might be doing that wrong, you go, no, because if that's wrong, I'm wrong, and I'm not wrong, and so you're wrong. And that's the barrier you run into with any innovation or any new information. And remember, a lot of new information is just marketing. It's not valuable. It's you know, you're buying a different brand of salt, but it's all salt. Okay. And so that's why I go back to being a heretic, is looking at things that aren't working and trying to find solutions to problems that nobody's looked at, or that nobody knows a better pathway or better technique. That first patient of mine, my mother, she was my mom, you know, and they all said, you know, she needs all of her teeth extracted. She's a hopeless case, you know, she's, you know, just take her down and take all her teeth out. And I go, it's my mom. I'm not going to do that. And so I went around to the chairmen of all the departments and I said, what can I do with this? And he said, well, you can try this. And anyway, that's when I started doing my first root canals and my first buildups, and she passed away. And my aunt kept all of her teeth for another 35 years. She died 10 years earlier than my mother. And my uncle and my fraternity brother, who both just passed away a year or two ago, was still intact. 45.
The work that you did.
Yeah, the work that I did was still intact 50 years later.
So,
and my two brothers still have work in their mouth that's intact. Not all of it. We started to replace some of it. And basically those are the patients that I'm seeing now, is patients I did work on 10, 20, 30, and 40 years ago. And they're coming back now and they're saying, you know, it's time to get this done. I want to get it done before you retire.
Right. Time to get a new set with you. So back to your mother, the one dentist said that she should have all her teeth taken out.
No, that was the consensus.
Oh, that was the
among all the faculty.
Okay. And then
she never lost another tooth in the next 45 years.
What did you do to your mother's? I
just did restorative dentistry at the very highest level. Remember, I had 20/10 vision. Yes. I had built-in 8.5 power. Right. And I went to the very best people because it was my mom. As a matter of fact, chairman of the department got mad at me.
Yes.
He said, why do you keep coming to me for checks? And I said, yes, I can do A work, and the instructor everybody likes gives everybody a C. A C for A work. And don't come to me anymore. I signed you out of the department.
So that was, wow, that's pretty crazy and severe. But the consensus among the faculty was that just extract all of her teeth. But you restored her teeth.
Two or three perio surgeries. Okay. We splinted teeth together. We took out bad roots. We did cut teeth in half. We did all kinds of prosthetic, very advanced prosthetic procedures that most people didn't do unless they were in a 3-year grad pros program. Well, I did more undergraduate full mouth reconstructions as an undergraduate, the students in the 3-year program, because I didn't have to go to lectures and learn about all the literature.
So could you walk us through the process of a restorative surgical procedure? What
Well,
does that-
it's restorative is the basis of dentistry. It's restoring lost or damaged tooth structure. And a full mouth reconstruction is when you have 20 teeth that are badly damaged. Okay, and you have to do everything over again. And that's what a full mouth reconstruction is. And it sometimes involves a lot of composite and a lot of buildups and a lot of clean outs and a lot of post-in cores on top of everything.
On a composite, you're building on the jawbone.
No, composite just bonds to tooth structure.
Oh,
Composite is what all full coverage or crowns or veneers or ceramic restorations, they're all bonded in with the same type of glue, same type of, that's a whole different thing. I can't go into it and
I know, we have about 10 minutes left.
Okay, so let me go into the other
Okay.
technology. I've already talked about magnification as the most important thing. I've talked about photography and high resolution displays allow the patient to see and understand stuff magnified. Okay, we have cone beam CTs or CBT, cone beam computerized tomography, which allows us to do a scan all the way from the top of the head to the trachea. It's very low radiation, very quick scan, and it gives us better information than the $3 million T scanner at the hospital that takes sections and then puts them all together. So this one takes all the sections 3-dimensionally, and then through the computer, you can go from top to bottom, from front to back, or from ear to ear, and you can see all the teeth. You can see the bone. A 2-dimensional X-ray, you can look at it like this, top to bottom. You can cut it any dimension that you want, and so it gives much more information. We also have digital scans. You were impressed when you saw the digital scan.
Yes.
Multiple images. It takes thousands of images and puts little teeny triangles that are 100 micron on a side on any surface. And that's how they made the sphere in Las Vegas. That doesn't have round surfaces. That's a whole bunch of triangles, and you get a sphere. So you can get accuracy down to 100 microns with that, which is good enough for a lot of dental procedures. Unfortunately, we try to get things down to 50 microns. And so we find that the scanners don't give us the accuracy that we can achieve if we go back to an older generation and then they can digitally print the same way with that surface triangle language, and they can build things up. And so now we don't have to pour up models. We can get things back in an hour instead of 2 or 3 days. And it just cut down the time.
Yes.
The restorative things can be CAD CAM or computer aided design milling, and you can have one of these machines in the office. They're not terribly accurate.
Right.
For $120,000, and the big labs $3 million machine, they can do 100 of these an hour, 24 hours a day, and it's more accurate.
Right.
So milling and printing and scanning are 3 of the new innovations in the last 10 or 20 years.
3D printing, is that what you're?
3D printing, 3D scanning, and laboratory work that's done in 3D printing. Okay, so you can do you can do the thing that goes on top of the image. You can scan, and then you can print what the scans of, and then through computer, you can print what you want to fit on there, and you do it all digitally.
Visually, and that's the 3D printing.
3D scanning, 3D printing, 3D fabrication.
In dentistry and fabrication. So, and you can do that in an afternoon?
Well, you can if the machine in office doesn't have the precision that the $3 million or the $5 million machine.
Oh, yeah.
So, but we can send all that data.
You can order it.
No, we can do it digitally. We can scan and send that data to the lab, and the lab can work on it that afternoon.
Right
then, and they can get stuff back to us sometimes in just 1 or 2 days.
That's amazing. Very quick turnaround to have a rebuilt tooth that you can implant into your patient's mouth.
Yeah. So, and obviously implants have been out for 40 years now. The new big rage are the zirconia implants because they pitch those that they're non-metallic. But if you look on the periodic table, zirconia is a metal, okay? And
But I guess the question is it toxic to us?
the zirconia isn't, but neither is the titanium oxide layer
Oh,
on the outside of
it's
traditional
inert
implants.
then.
And we had 40 years experience with that.
Okay.
And there's precision. And if you use one of the legacy manufacturers, 20 years from now, if a screw breaks, you can get the part. If you use off-label stuff, it's sometimes a third or less of the cost. If it breaks, you're out of luck because
Okay.
the parts aren't available.
Well, I want to ask you
Okay.
one last question, and
All right.
that is, so you're going to continue being our dental heretic?
Oh, I'd come back. I'd love to come back and go into some of the areas in more depth.
Yes. So what do you think, where do you think we're going from here?
Well, my own personal goal is to publish a book called Teach Your Dog to Floss. And I have my kid's chocolate lab. I have a picture of him with green floss on his paws. And it's a children's book for mothers and grandmothers.
Nice.
It says,
very
you
nice.
can't teach a dog to floss, silly. But if you brush their teeth from the time they're a puppy, they will pout if you don't brush their teeth every day. And just that change in your dog or your cat, cats won't let you do it there, see, but will probably double the dog's life expectancy because they die of periodontal
Cavity. Oh,
Just
okay.
anything.
Periodontal.
No, not so much cavities, but periodontal disease. And that's where I learned that if you take a child and make it a bonding experience early on and you know how to do it, the rest of their life, they just don't have any disease producing bacteria around the pencil line. And the pencil line is an imaginary black line that goes all the way around the tooth, at the gum line, at the junction, at the gasket, because the soft tissue seals around the tooth to keep out bacteria. Remember I told you if you have a dysbiosis or a war going on in the gut because you have a leaky gut because you don't have probiotics, that prebiotics are being energy, then the same bugs on that pencil line, your body reacts to, and it's your body fighting the organisms that it's having a war with in your gut. And matter of fact, you can't feel it in your gums, but it destroys the attachment apparatus, the gasket, the seal around the tooth. And that's what periodontal disease is.
Oh, it's great to know the mechanism by which periodontal diseases affect us.
So the two things that I want to do is make cleaning the pencil line something that every mother and grandmother does for their children and their grandchildren. And that's just an educational thing. And hopefully that book will help. And the other thing is all posterior teeth have holes and cracks in them. We call them pits. And those pits and fissures get inoculated, transmitted communicable disease from their parents very early on. As soon as they get older, their parents' toothbrush, and and they're trying to do what they see their parents do.
Right.
And if you open those up under high magnification and you do a very skillful bonding, those restorations, those fillings last longer than any filling in my whole career. And that alone, obliterating these cracks and holes in teeth, natural occurring cracks and holes that go all the way through the enamel castle wall into the hostess twink, the 24-hour buffet. Those areas reseed the mouth every time you take your toothbrush out. So if you learn how to clean the pencil line, and especially in between the teeth, clean the pencil line, especially in between the teeth, and you obliterate those, like I said, that's good for about 5 to 10 full week vacations in Hawaii over a lifetime. Person.
Yes.
You can send your child to college for what it would, one of the expensive colleges for what you would dump in dentistry. Some people say, well, wouldn't this put dentists out of business? And they go, I don't care. My goal isn't to employ dentists. It's to help people with better health. And if we did this to everybody from now on, there'd be enough work to do for the rest of every dentist's life.
Well, let's go back to cleaning the pencil line. Is that flossing or using a?
Well, flossing doesn't work very predictably in most people. I just had something out, but we use pictures and teepees. These are little pipe cleaner micro bottle brushes, and you can go through and you clean both sides. Between that and a soft, here we got one. You can see.
Let me see. Oh, yes, very good. Yes.
Yeah, it goes through like that. That's much faster than flossing.
Very much faster. I'm using it now more and more.
That gets the pencil line in between the teeth, and you can. What do I do with them? My toothbrush. I can right now. I have toothbrushes in my pockets in the car.
I'm not surprised.
By the same. And what you're trying to get off that imaginary pencil line is is soft white yogurt. Doesn't take a Brillo pad and toothpaste and a wire brush. You just have to, if you're trying to get yogurt off a white plate, all you have to do is touch it mechanically, gently, and rinse it. If you don't get it in every 24-hour cycle, that biofilm bacterial adhesion to the tooth surface can turn into super glue. Now you can't brush it off. That's what the hygienist polishes off. And then if it's where your saliva glands put in calcium on the back of your front teeth or the outside of the upper teeth, you build up gigantic brick houses, that's hardened plaque. So it starts off soft plaque, it turns into super glue. The super glue is what stains, and people don't put the super glue on there. What they don't like is the stain that the super glue picks up, okay? And so they think when they get that polished off that their teeth are clean. But if you don't keep your teeth clean in the next 24-hour cycle, it just starts over again.
I see. Well, Dr. Vigoren, this has been a real treat to have you on, telling us, just dispelling a lot of myths and also explaining to us the evolution of our own dental health and how it affects other aspects of our lives, lack of sleep and so on.
Sleep, perfusion, gut health, and dental disease. And then comes diet and micronutrients. As we'll throw those in.
Okay, those building blocks of good health and longevity.
Yeah, and I want to thank anybody for watching that.
Yes.
I appreciate people listening and caring.
Yes. And you do this selflessly. You are concerned for people's overall health, even at the risk of your own practice.
Well, it's gratifying, and it makes me, like I said, 5 decades I've been practicing.
Yeah, you've been practicing, studying, observing, and dealing and helping with people.
And it all went down to that dean who said, "You're going to have to learn it all." And I said, "No, me, just keep learning."
Right. Are there any final words that you'd like to share with us as we close the show today?
No, I appreciate the time you've given me. Again, magnification, high resolution photography, high resolution display, cone beam CTs, high resolution pulse oximetry to see how fragmented you are, and then the new advances in digital scanning, printing, and fabrication. That's the new technology. And then back to health, sleep, perfusion, gut health. Then dentistry is number 4. I used to have dentistry number 2, and then I learned we weren't number 2. And then exercise and nutrition and micronutrients. Okay, that's my list.
All right, duly noted. We have to create that list and live with your tips in mind today, and also the knowledge that you've shared with us. So rich.
Make living healthy a hobby.
I will remember that. That's going to be the tagline for this show.
All right.
Thanks so much. And we'll see you again next Wednesday. Take care, everyone.